Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, how are you today? I hope you all in a good conditions. Today we are going to learn about medical documentations. What is medical documentations? Medical documentations is an instrument which helps the care staff to record all information about patients' health status and the procedures provided by hospital staff. The purpose of documentations are: the first is communications, the second is accountability, the third legislative requirements, and the last is quality improvement. The purpose of collecting and storing patients' information is to make it available for decision making at the point of care or for analysis and actions for management and policy. There are some points the physicians must adhere to documentations. The first, the date of patients was seen or admitted to the hospital, the reasons for why the patients has come for consultations. The third is appropriate history and examinations for the patients presenting complaints. And the fourth is evaluations and treatment plan during patient stay and until after the patients have been discharged. Jadi untuk beberapa poin yang harus diperhatikan oleh tenaga kesehatan, bisa dokter, perawat maupun bidan tentang dokumentasi itu adalah yang pertama adalah tanggal pasiennya masuk, kemudian alasan pasien itu datang, kemudian riwayat kesehatan dan juga pemeriksaan yang sudah dilakukan, kemudian evaluasi dan juga treatment yang sudah diberikan oleh pasien sampai dengan pasien itu pulang atau keluar dari rumah sakit. There are some essential informations in medical record. The first is date and time of call. The second is provider's name and verbal telephonic order. The third is signature with the complete date, year, and military time. And the last is document every attempt to contact medical. With documentations of medical records, particular emphasis must be placed on the 5 factors that improve the quality and usefulness of charted information. The first is accuracy, relevance, completeness, timeliness, and confidentiality. I'll explain one by one. Accuracy. Each individual medical record must be correct. Information in the medical record is relied upon for accuracy throughout lifetime. Inaccuracies, either commissions or omissions, lead to improper medical advice being provided in error and may result in adverse healthcare outcomes or in legal proceedings. Jadi ya namanya medical records itu harus benar, harus akurat datanya. Kalau datanya itu tidak benar, tidak akurat, maka akan berpengaruh pada perawatan dan juga pemberian terapi yang tidak tepat. The second is relevance. It is important that medical records contain only information relevant to the patient's healthcare. Inclusions of inappropriate and irrelevant information could result in damaging legal actions. Jadi untuk apa saja yang dicatat dalam medical records itu juga harus relevan dengan data-data yang dimiliki oleh pasien kita. Completeness. All documentations, including that from the clinics, hospital, and TLC, must be included in medical records. Every document should be free from omissions. Documentation is sent to CPRS, which maintains a complete record for each patient. The Joint Commission requires continuous review of medical record documentation throughout the year. And what is TLC? TLC clinics is the trauma-informed linkage to care clinic, as known as the Purple Clinic. This is an institute for family health oversensitive, respectful health care for anyone who has experienced sexual trauma, exploitations, or violence. Jadi kalau yang namanya TLC itu klinik perawatan khusus bagi trauma, ya. Trauma itu bisa karena sexual abuse, kemudian ada eksploitasi seksual, ya. Itu nama kliniknya adalah TLC. And what is CPRS? CPRS is Computerized Patients Record System. Jadi pencatatan medical record pada pasien secara komputerisasi. Timeliness. There are specific time requirements for completions of the medical records, history and physical, completed and signed within 24 hours of admissions. Post-operative note written immediately following surgery. Operative note dictated and signed within 24 hours of operations or procedures. Medical records must be completed within 7 days of discharge or outpatient visit. Confidentiality. Medical records are confidential and protected by authority of the Privacy Act of 1974, its amendment, and HIPAA. Don't leave patients identifiable information on your computer screen or exposed in your work area. Don't talk about patients or families in hallways, elevators, or in other public places. Don't release medical record information without the patient's consent. Jadi yang namanya medical records itu bersifat rahasia, jadi tidak boleh semua orang itu bisa mengakses medical record pasien-pasien kita. Termasuk juga kita tidak boleh membicarakan tentang pasien kita itu di lift, di jalan, ya. Dan ini berkaitan dengan hukum nanti, ya. Jadi harus hati-hati tetap menjaga kerahasiaan dari pasien kita. Legibility. Physicians get a bad rap about notes and prescriptions being unreadable and illegible. CPRS makes medical records easy to read. Omissions. Similarly, innocent omissions in medical record documentations can have dire consequences. And then we learned about the Varnese management. Yeah. The management process is a clinical problem-solving, decision-making, caregiving process that oriented in nurse midwifery in the early 1970s. It provides a method of organizing to and actions in logical sequence for the benefit of both the patients and the healthcare provider. The management process consists of 7 sequential steps. 7 steps of Varnese management. The 7 steps constitute an overall framework that is applicable in all situations. Each step then may be broken down into finite tasks that vary in accord with the conditions of the woman and or newborn. As we know, there are 7 steps in Varnish management. The first is investigate by obtaining all necessary data for complete evaluations and the woman or newborn. The second is make an accurate in identifications of problems or diagnosis and healthcare needs based on correct interpretations of the data. The third, anticipate other potential problems or diagnoses that might be expected because of the identified problems or diagnoses. The fourth, evaluate the need for immediate midwife or physician's interventions and or for consultations or collaborative management with other healthcare team members as detected by the conditions of woman or newborn. Develop a comprehensive plan of care that is supported by explanations of valid rationale underlying the decisions made and is based on the preceding steps. The sixth, assumes responsibility for the efficient and safe implementation of the plan of care. The seventh, evaluate the effectiveness of the caregiving, recycling appropriate through the management process for any aspect and care that has been ineffective. Jadi sebenarnya ini sudah dibahas juga di mata kuliah di dokumentasi kebidanan dan juga di ini yang pertama kali Anda dapatkan tentang konsep kebidanan ya, bahwa ada yang namanya manajemen Varney untuk asuhan kebidanan ya. Jadi ada 7 langkah Varney. Yang pertama adalah pengkajian data, kemudian melakukan identifikasi terhadap masalah dan juga diagnosisnya, kemudian antisipasi masalah, kemudian menentukan kebutuhan pasiennya, apakah kebutuhannya itu rujukan, kemudian konsultasi atau tindakan kolaboratif dengan tenaga kesehatan yang lain. Kemudian yang kelima itu adalah merencanakan asuhan yang akan kita berikan kepada pasien. Kemudian yang keenam adalah implementasinya, dan yang ketujuh adalah and let's discuss the steps one by one. The first step is the gathering of the complete database for evaluations of the new woman or newborn. This database includes a history, physical and pelvic examinations as indicated, review of the current chart or old hospital records, and review of laboratory data and reports of adjunctive studies. In short, all pertinent information from all sources that has be bearing on the conditions of the woman and newborn. So, untuk di langkah pertama ini adalah langkah pengkajian data. Jadi kita kumpulkan data selengkap-lengkapnya, baik itu adalah data subjektif, data objektif, data pemeriksaan laboratorium atau pemeriksaan penunjang yang lainnya, semuanya dikaji dengan lengkap. And then the second step is make accurate identifications of problems or diagnosis and healthcare needs based on correct interpretations of the data. The interpretations of the data into specifically identified problems or diagnosis and healthcare needs. The words problems and diagnosis are both used, as some problems cannot be defined as diagnosis but do need to be considered in developing a comprehensive plan of care. Jadi, langkah yang kedua adalah interpretasi data. Interpretasi data itu termasuk juga dalam merumuskan diagnosa pada kasus tersebut. The third step is identifying other potential problems or diagnosis based on the current set of problems and diagnosis. It's a matter of anticipations, preventions when possible, watchful waiting, and preparations for any eventuality. This step is vital to save care. For example, a woman with an over-distended uterus. The midwife should consider the possible reasons for the over-distensions. Polyhydramnions, large for dead baby, gestational diabetic mother, or multiple gestations, and then anticipate, take precautionary measures, and be prepared for the possibility of an immediate postpartum hemorrhage as a result of uterine atony from the overdistensions. Contohnya itu tadi, kalau misalkan ada perempuan ya hamil dengan overdistensi uterus, maka bidan itu harus memikirkan penyebab dari overdistensi itu apa? Apakah karena polyhydramnion? Apakah karena bayinya besar? Ataukah karena bayinya kembar? Gitu kan? Nah, kalau sudah tahu bahwa ada overdistensi uterus, maka kita harus memperkirakan bahwa nantinya ibu ini akan berpotensi untuk mengalami atonia uteri yang disebabkan karena overdistensi uterus. Jadi kita harus memikirkan potensi diagnosa potensialnya itu apa, ya, terkait dengan diagnosis pada pasien. Next step is evaluate the need of immediate midwife or physician's interventions and or for consultations or collaborative managements with other healthcare team members as dictated by the conditions of the woman or newborn. The fourth step reflects the ongoing nature of the management process, not only during periodic primary care or prenatal visits, but also while the midwife is continuously with the woman, such as when she is in labor. New data are constantly obtained and evaluated. Some data indicate emergency situations in which the midwife must act immediately in the interest of the life of the mother and or baby. Next, develop a comprehensive plan of care that is supported by explanations of valid rationale underlying the decisions made and is based on the preceding steps. Is an outgrowth of the identified current and anticipated problems or diagnosis and healthcare needs, and also involves obtaining any missing or additional pieces of information for the database. A comprehensive plan of care not only includes what is indicated by the conditions of the woman or newborn and any related problems, but also outlines anticipatory guidance for the woman or parents as to what to expect next, teaching and counseling, and any necessary referrals for social, economic, religious, family, cultural, or psychological problems. The sixth is implementations of the comprehensive plan of care. This step may be done wholly by the midwife or in part by the woman or parent, the midwife or other health team members. Efficient implementations minimize time and cost and enhance the quality of care. A critical component of implementation is documentation that is timely, accurate, and thorough. The last is evaluations. This is the final step to find out whether the treatment plan is suitable for the client's need and whether the implementations given to the client is consistent with the diagnosis. The plan is deemed effective if it did and ineffective if it did not. Okay, I think that's all for the medical documentations. If you have any questions, let's discuss it in Google Classroom. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.